I'm Commissioner Christian Leinbach, and I want to welcome everyone to another edition of the Berks County Commissioners Weekly Update. Today, we're going to be focusing on the broad issue of COVID-19 vaccine and the various efforts that are going on here in the community, dealing with a lot of different areas. And so before we go into the program, there are going to be 4 different areas that we'll focus on today. We're broadcasting on Microsoft Teams live event, also on BCTV, and on the county's Facebook live page. We are not broadcasting on YouTube. In addition to that, we are streaming, courtesy of the Hispanic Center, onto the Hispanic Center's Facebook page. At this time, I want to recognize my executive assistant, Mary Buer.
Thank you. Comments or questions must be germane to the topic being discussed and include your full name and municipality where you reside. If you are from the media, please put your name and who you are with. Non-media participants, please limit your questions and comments to 1 per person.
Thank you very much, Mary. So the question is, where are we with the COVID-19 pandemic, the vaccine, and what's still to come? Let me say right from the top, and I know all of our presenters today will agree, we do not have all the answers, but I will tell you that I'm extremely proud of the partners throughout the county and the role each of them are playing in making the vaccine available to people in our community. Before we go into the program, I want to give an opportunity to my colleagues to also make some opening comments. And we'll begin with Commissioner Kevin Barnhart, Vice Chair of the Berks County Board of Commissioners. Commissioner?
Thank you, Commissioner Leinbach, and welcome to our esteemed panel today. I won't take a lot of time because I'm discussing item 3 today, but I want to thank our partners in the community for the vaccine task force, starting up our center in the North Reading Plaza in Muhlenberg Township. We have with us Department of Emergency Services, a member, Co-County Wellness, which will be doing the call center, the Community Health Center that will actually doing the vaccinations, BARDA with their free transportation to and from the vaccine center, Area Agency on Aging, which has been working tremendously well in getting people who do not have internet access appointments. And of course, our library system will be helping us with outreach to the community. And again, reminder, go on doyourpartberks.com and sign up for our newsletter. It gives you, it's chock full of information about the vaccine, about COVID-19 and those things. This will be your one-stop shop to find out when we open up this center, information concerning the center at North Reading Plaza. So thank you, and I will have more to say under item 3. Thank you.
Thank you, Commissioner. And now, Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. First, I want to welcome everyone who's watching our show. We're bringing some great information today. I also want to thank our panelists. Again, we have Dr. Powell and Dr. Keller here on with us sharing their information. I want to thank the doctors for their time and for all the work they put into help keeping our community safe. I also want to welcome the other members of our guests who are, one is Mike Toledo from the Hispanic Center, and the other are owners of local pharmacies who have dedicated their time and their resources to help with this efforts as well. So thank you to both of you as well. Thank you for being here as well and for everything that you do to help keep our community safe. As Commissioner Barnhart mentioned, there's a lot of people that have been working on this. It's not the effort of one person or one group, but rather a community effort. We have people from the county, we have people from nonprofits, we have business owners. So there's a number of people coming together, working on this effort to make sure that everything can come together in a way that will benefit the community of Berks County. So again, thank you to everyone who's involved in this. Thank you to those who are joining us today. And I look forward to learning more great information today on this program as well.
Thank you very much, Commissioner Rivera. And as I've done before, I want to note that all three of the Berks County Commissioners, right out of the gate in early March of 2020, committed to do what is best for the residents of this county. We've been able to work with our partners here locally, with our partners at the state and federal government, but it's been a real privilege to have people that are simply focused on doing what's right and solving problems to the extent that we are able for our Berks County residents. We're going to cover four specific areas today. The first area will be a brief update on vaccine statistics. If you want a more in-depth presentation, that will take place tomorrow at the Commissioners' Weekly Meeting. That is broadcast at starting at 10 a.m. Our second area is going to be focusing on local vaccination efforts, and we're going to be highlighting three entities. These are not the only three entities doing the local vaccination efforts, but we wanted to highlight so that people understand there are folks out there that are stepping up in our community. I'm looking forward to that section. Then the third area will be an update on the Berks Cares Vaccine Center and Call Center. And then that will be followed by a COVID-19 vaccine education, safety, and efficacy. That panel includes Dr. Deborah Powell and Dr. Mary Keller. And we want to note, because there's normally three folks that we rely on, Dr. Powell, Dr. Keller, but also Dr. Held from Penn State St. Joe's. He would have joined us, but he had a scheduling conflict, and he had confidence in Dr. Keller and Dr. Powell for the presentation. Again, if you have questions or comments, please follow the rules that were outlined earlier, but post those in Microsoft Teams comment or the Q&A section, or on Facebook in the comments section. With that, we're going to begin, and we will start, as noted, with Brian Gottschall. Brian is the Director of Berks County Department of Emergency Services. He is also the lead for the Berks County COVID-19 leadership team. Brian Gottschall.
Thanks, Commissioner. As you noted, we would invite anybody who's watching this afternoon to tune in tomorrow morning, Thursday morning, during the Commissioner's normal meeting at 10 a.m., where we take a little bit deeper dive into the statistics and sometimes answer questions that come in from the community about them. So we didn't really want to reproduce that segment this afternoon, but we thought it was important to at least speak to this, particularly given yesterday's local news that illustrated a significant number of cases identified in Berks County for the period of yesterday. And as we've answered a couple times with respect to questions that have come in from the public, we can't speak to why cases go dramatically up or down in any given day. What we can say is that we don't believe that that's an accurate way to look at the statistics. So as I'm sure many people have heard, if they pay attention to local news, we did add 550 COVID cases yesterday in Berks County. That is the second highest number of cases that we've added on any single day since we began looking at this data last late winter, early spring. However, I do want to illustrate that we did have a single day north of 500 cases in November of 2020 and again in January of 2021. So a day like this is not without precedence. My gut instinct would be to say that it is not reflective of some single day catastrophic COVID situation. More likely it has to do with data catch-up, and that data catch-up does happen every once in a while where the labs are late in reporting or samples are late in getting from point A to point B. And I would illustrate that we actually have had another day that was north of 1,000 cases. So what I really want to do is not look towards that single day number that we saw yesterday, but instead look at our smooth statistics. And that's what I'm displaying on the screen here, where we see what our case count is over a 14-day period averaged out. And by looking at those smooth statistics, we're able to see a much clearer picture of what's going on in the community over a period of time. So on one hand, we don't want to be unnecessarily alarmed by our single-day case count of 550 yesterday, but on the other hand, we want to look at this smooth statistic and see that we see a continuously upward rising number of cases from our low in late February, early March. And even though we want to avoid being alarmed by yesterday's number, we do want to pay some due consideration to the fact that we see cases in an upward rising trend for now the last month and a half to almost 2 months. And as a community, say that we can do better. We can, even though we have vaccine, even though we're seeing vaccine rolling out in larger numbers in the community, we as a community still want to be attentive to those mitigation measures, and we want to be making sure that we're doing the right thing for ourselves, for our loved ones, and for our community as a whole in making sure that we're taking appropriate mitigation actions while we're waiting for the vaccine to more fully saturate the community. With that, I want to speak a little bit about vaccine and what we see within Berks County on an ongoing basis. Again, as we report on a weekly basis at the commissioners' meeting, we've been advised by DOH that for the foreseeable future, Berks County is level set at about 12,000 doses. That means no matter how many providers we have in our network, no matter how many more we add in, 12,000 doses is what's going to come into Berks County in any given week. I do want to be emphatic that that is first doses. It doesn't represent second doses. Many of our providers are giving 2-dose vaccine in the form of the Pfizer and Moderna products, and those second doses come in over and above the 12,000 new first doses that we're level set at on a weekly basis. In addition, that number does not include vaccine that's coming in through other special programs. So at one point in time, really the only vaccine that was coming in was through the DOH programming. Then we had the retail pharmacy partnership program come on board. That provides us somewhere in the neighborhood of 4,000 new first doses on a weekly basis these days. And slowly we're seeing other programs open up. Our partners at BCHC are able to find vaccine through their HRSA relationships, and our pharmacies are able to find some small allocations of vaccine through programs that are open through at the federal level through pharmacy partnerships. So again, I don't want to take away from any of our providers that I think are going to talk about their really strong, great efforts that are happening at the community, but that's an overview of both the case situation as well as the vaccine situation in Berks County as it affects everybody. And back to you, Commissioner.
Thank you very much, Brian. Appreciate your input as always. And again, if you'd like a much more in-depth view of the data, tune in to the commissioners meeting tomorrow morning at 10 a.m. If you're not able to tune in exactly at 10 a.m., Facebook and YouTube Live will have the video that you can watch at some later time that's more convenient. Our next panel represents 3 individuals, and we wanted to have individuals that are working within the community through their particular organization. 2 of these individuals are owners of local pharmacies, and the 3rd of a local nonprofit. And what we're going to ask them to do is to kind of share their story. And when I say briefly, we don't want to take a half hour on the story, but tell us a little bit about why you started up this effort, how the community has responded, and why it's important to you. We have 3 guests today, and I'm very excited to see each of them. 2 of the pharmacy owners, we have Ed Houdon. He's owner of the Medicine Shop in Boyertown, Pennsylvania. We also have Kola Salako, co-owner of Oakside Care Pharmacy in Reading. And before I recognize our nonprofit, I want to say something for myself. I have ended up through this COVID experience, and especially the vaccine efforts, to have a new appreciation for the value of local ownership of relatively any business, but especially a pharmacy. I'm a person, like probably many others, that was absolutely fine with the various chain pharmacies, and I'm not going to say any names, But I realized something early on, and actually in the discussion with Ed Houdon in his early efforts. And that is, when you are a local owner, one, you have the flexibility to make the changes that are necessary to do a mass vaccination. And two, you have the personal connections to the community that build up that passion to say, I'm going to step out of my comfort zone. Where the comfort zone for Ed, and I'm sure for Cola, was doing the work within their pharmacy. And now suddenly they're out in the community. So we're going to hear from both Ed and Cola. And then after that, we'll hear from Michael Toledo, who is head of the Daniel Torres Hispanic Center here in Reading, Pennsylvania, and has been involved in a number of vaccine efforts here in the city of Reading, with a number of different partners being involved in that effort. So let's begin. Start with Ed Houdon. Ed, tell us a little bit about your story.
Thanks, Commissioner. Well, the story begins with an article that you were quoted saying that pharmacies could only do approximately 20 vaccinations at any given day. And one of my peers was kind of upset by that, and I took a different approach. I found somebody that knew you, and they facilitated a meeting within an hour and a half. And then the rest is pretty much you. Took the time to listen to how I wanted to approach the vaccination effort within our local community. In that I know my community, I know the people, I know the volunteers that we can get to help us get to those patients, those elderly patients that didn't have computer access or were technology. They're fearful of technology. I mean, it's just that whole demographics, unfortunately, were underserved at the very beginning. I just had a meeting that Monday before and had a PowerPoint presentation available. I showed it to you. I showed you how the churches, the senior center, and the school and I would be collaborating together to get the vaccine into arms and helping them register for their consent forms and their appointments. You presented that to the Department of Health and the governor at, I think, 11:30 that day. And the next day I opened up my PA Sys and I saw 1,000 doses of Moderna. And we effectively got that out. And then they upped the ante to 1,500 and then 2,400. And now we're at about 3,500 doses weekly. And the outreach and the appointments are still being booked solid within days. But it started with a conversation, and that impressed me because people want to talk, but sometimes they don't want to listen. And you listened, and we communicated, and that got us results. And I appreciate that. And so does our community. So thank you from Boyertown and the surrounding areas.
It was a small part, because let me tell you, and Cola knows this, and so does Michael, it takes a tremendous team. And I was down at your facility at the Boyertown High School. Talk a little bit about the volunteers and then the staff that you have to bring in that are skilled staff. That is not an easy task.
It's not, but at our events, you'll see a lot of joy in people's eyes, a lot of relief, a lot of people thinking and feeling this may not be it'll be a new normal, but it'll reconnect families. As a provider of healthcare, I see too many people. I've seen too many people dying on Zoom calls. People that are, have dementia that are progressing further because, and into, a midstream person with dementia may be going to the far end because their normal daily events and stimulus have been declined. Their connection with family has declined. So with each event, we have more people that want to volunteer because they see it's connecting the community in a way that it brings joy to me. I mean, I'm tired at the end of the week. and Monday morning it's a little rough getting up, but I would not miss that day for anything, and a lot of my volunteers wouldn't either. So it is a group effort, it is a community effort. I mean, some of the people, because we're right on the border, are coming in from Montgomery County, so the volunteer pool, they're coming from Springford, area, school district to help out, whether it be alphabetizing the consent forms, to taking temperatures, to making sure that our section for ambulatory patients, people have wheelchairs and accessibility. It's every week it gets a little bit better and a little bit more unique. Last week was a little challenging because we had a bunch of second dose appointments that 240 showed up at 1 o'clock as opposed to their scheduled appointment. So we're trying to put messages out there to come at their scheduled time, because 240 more parking spaces, 200 more people not socially distancing themselves became a little bit of an issue. I know that we all have things to do on a Sunday afternoon, but people need to be just aware that their scheduled appointment times are important for the functioning of our clinics. Scheduled appointments are great because we're getting people that are canceling, and I know that's going to happen, but we're filling them up as fast as we're canceling them. We're just trying to enforce people to feel comfortable knowing that their dose is allocated and not make multiple appointments, because that's becoming a problem again. I'm sure that they're fearful of dose security, especially with J&J's issue that they're having right now. But it's good. It's constantly navigating new decisions and a new climate of people. I mean, now we're going to younger, more ambulatory patients, so the needs are a little bit different.
Well, thank you, Ed, and I'm sure there'll be some questions for you. Sure. Let's go over to Kola Salako, co-owner of Oakside Care Pharmacy in Reading. And Kola, you've done everything that you've done has been in Reading, and Reading is our largest municipality by far, over 90,000 residents. We also have some of the most needy folks in our community in the city of Reading. If you could share a little bit of your story, why did you take the step to just move out of your comfort zone and say, I'm going to take this on? What kind of results, reactions have you seen from people in the community that you've been able to help?
Sure. Thank you very much. I appreciate the opportunity. Oakside Care Pharmacy is located in the Glenside area of Reading, right in the inner city. A significant number of our customers are low-income clients and economically disadvantaged. To reach many in this group, we've had to partner with many community organizations. We noticed after our first few vaccination clinics that members of the community that live in the housing projects and in close proximity to our pharmacy were not well represented. Additionally, the participation of members of the African American community was not really what it could be. So this led to collaborative efforts by our pharmacy and several community organizations, and I would like to highlight a few of those, at least 3 of them. I know you mentioned Michael Toledo, the CEO of Hispanic Center. He's been very, very instrumental to the successes that we've had so far. When we started, we noticed that he had done a clinic where 1,000 people were vaccinated. I think he collaborated with Reading Hospital at the time. So I reached out to him and told him about the challenges we're facing and how we could collaborate so that we could get more representation from the Hispanic community and the African American community. So he connected me with the Reading Housing Authority Resident Service Director. So we did a clinic where the resident service director partnered with us, and he went door to door in their housing units to try to enroll people who many are hesitant in getting the vaccinations. And through this effort, hundreds of people have since been vaccinated in multiple clinics. More recently, we did a clinic at the Michael Pick Community Center located in the Glenside housing project. In that location, we vaccinated about 400 people. Many of them just had to walk a few yards to get into the clinic. Next, we reached out to NAACP to see what they could do to get some of their members to attend some of our clinics. So they reached out to some of their member churches and tried to sign people up. Also, they had a discussion forum where they invited many local, health professionals to help educate some of their members. And that has led to a clinic where, again, we did over 400 people, and their second doses will be administered this coming Sunday. Right across the street from our pharmacy is a church called Christ Lutheran Church, and they have given us their facility for use at any time we want. And we've been able to do vaccinations there at least for 5 weekends, and we're told we could use that facility even during the week. So that's essentially an extension of our pharmacy because it's just right across the street from us. So the community is really stepping out in helping to facilitate this effort. And last but not the least, I mentioned earlier, Hispanic Center and Olivet Boys and Girls Club. The CEOs of these two organizations have been more than supportive in providing clinic facilities for us, volunteers, and helping us with logistics support. A few weeks ago, we vaccinated about 800 people, and last Sunday, about 90% of them returned for a second dose. Next week, we're already planning a joint clinic where that's already filled up with hundreds of people lined up for that. Another collaborative effort we did was last Saturday. We had a clinic, and he had the Hispanic Center had one as well. And at the end of that clinic, there were some members who could not get vaccinated, and he reached out to me as usual, and he sent them over to our clinic because we were not done, and we were able to vaccinate those on the first dose. So these collaborative efforts are just invaluable to the community, and I can't thank these members of the community enough, including volunteer doctors from Reading Hospital and other areas in the community who show up to our clinics to help with vaccination, because of course we can't afford to hire 20 vaccinators. So the volunteer efforts are very, very much appreciated. Thank you.
Kola, thank you very much. And same as Dr. Ed, we'll definitely be coming back with questions. In preparation, the one I would like you to be prepared to answer, I have it listed on my list at the end, but I'd like both of you to specifically address the unique value of local ownership of pharmacies as it relates to this issue. I just think it is a huge takeaway for me, and I think a lot of other folks may never have considered that value. You're living proof of how important it can be. Our next panelist is Michael Toledo. So Michael, you've already been introduced by Kola. The partnership that you've had really was key, as he noted, in getting his effort started. Share with us, the Hispanic Center has been a critical part of our community based right in downtown Reading. You've partnered for years with our area agency on aging, Meals on Wheels, and things like that. But in the midst of the pandemic, your operations, your in-person operations have been shut down. And yet, when it came to the vaccine effort, you jumped in to position, you mobilized. Talk to us a little bit about why you did it, what was involved, and the benefits that you've been able to see here in the community of Reading at large, but the Latino community specifically, because I know there's obviously the Hispanic Center that's a major area of emphasis, and the city of Reading has the largest percentage of Latino population, I believe, in any city in the Commonwealth of Pennsylvania, right around 70%. Michael.
Well, thank you, Commissioner, and to all the panelists that are on. You know, we all have a role to play. I mean, if there was ever a common theme that we'll hear today, it's that very fact. You know, the Hispanic Center's mission is about partnering, collaborating to help improve the quality of life for the families that we serve. So, you know, when the pandemic hit, and as you mentioned, we had to close our doors. What we had to do was quickly pivot to say, okay, though we can't help people that come to the Hispanic Center because of the pandemic, what role can we play to help meet the needs and improve the quality of life of those families? And initially, last year, it was the food insecurity, as you had mentioned, addressing that need and making sure that the most vulnerable among us and our families had food, nutritional food on the table. But when the vaccines became available, it was a matter of how do we get the vaccine available to the most vulnerable in our community. Once again, the Hispanic Center and our team we needed to step up. We needed to pivot again to break down barriers and build bridges to how do we reach our most vulnerable, who are at a higher probability of getting a positive COVID test, that were, again, at a higher level of risk. And as we heard earlier in the call, you had the issues of the digital divide, that people had a hard time trying to register for appointments. You had the social determinants of health regarding transportation, how to get to a clinic that might be outside of the city. You had language barriers. So those are all barriers, transportation, the digital divide, language, that we felt that we needed to address. We needed to break down those barriers and build bridges to our consumers where they are, to our community members where they are. So we reached out to the partners that we had in our community, initially with Reading Hospital, reaching out to them, letting them know that we stood ready when they were ready, when they had vaccines, to do a clinic at the Hispanic Center. So we started with the hospital, and we vaccinated over 1,000 individuals in our community. And I'm happy to share that it was across the board diverse, the people that we were helping. You know, just because the Hispanic Center was originally formed 50 plus years ago from the first Puerto Ricans that came into the city, the services we provide are for everyone, Anglo, Latino, African American, and the clinics represented that. We were helping everyone to be able to get vaccinations in the city. After that, we then were reached out by our good friend Cola at the Oakside Care Pharmacy that heard of what we did and wanted to partner and said, how can we partner with the Hispanic Center? Could you help to establish partnerships within the community to be able to get more individuals vaccinated? And through that partnership with COLA, we were able to do clinics, not just at the Hispanic Center, but throughout the city, utilizing our valued partners in the Olivet Boys and Girls Club, where we've held 2 or 3 different clinics within the city, our friends at the Reading Housing Authority, where we had clinics there as well. So again, reaching the community where they are, that has been the secret sauce, really, of the work and the collaboration that the Hispanic Center's done with our partners that are willing to partner with us. From that perspective, the clinics have been great, but also what we've done around marketing and what we've done around reaching the community to address the hesitancy issues that exist in our community, utilizing our social media platforms, town halls the Hispanic Center has hosted with our partners, and also Spanish language radio, partnering with those radio stations to address the issues and concerns around hesitancy. We're pleased to be able to share that through the various clinics that we've had. Now we have many members of our community that can say, well, my grandparents have been vaccinated, my coworkers have been vaccinated, my neighbors have been vaccinated. And that has had a positive effect now, because more and more people are now saying, okay, I guess it is okay to get vaccinated. And we have not had a clinic yet that has not been sold out. I should say sold out, that is not full with appointments. And we are committed at the Hispanic Center to partner with our partners that have the vaccine, and we'll continue to do weekly vaccination clinics until everyone in our community that wants a vaccine can get a vaccine. Again, we all have a role to play, and it's our mission to serve, and the Hispanic Center is only too happy to be able to be a partner to help support this important mission in the community.
You're muted.
You're muted.
I see that. Thank you very much, Michael, Cola, and Ed. I really appreciate you being on. Hopefully you can stay with us. I think I've shared this quote with Ed. It is a quote I've used quite a bit in the last 12 months. It's from Theodore Roosevelt. And he said, do what you can with what you have where you are. And that is exactly what each of you have done and are doing. If you had got 400 doses or you get 1,500 doses, you're working and you're making a difference in your community. Thank you very much for doing that. We're going to move on in our agenda, and I want to recognize once again my colleague, Commissioner Kevin Barnhart. He has taken the lead on the mass vaccination clinic that's being done in partnership with the Berks Community Health Center and Cook County Wellness, as well as our Berks County Library System. Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach. Again, I want to emphasize doyourpartberks.com is the place to go for all the up-to-date information about not just this vaccine center, but everything else going on in the county. We have put together, which we'll approve tomorrow at a commissioners meeting, our ad budget to market and promote this vaccine center. And along with that, there will be a 1-888 phone number, which will become available on Monday through Cook County Wellness Services. They will be taking calls from people throughout the community if they need any help finding vaccines in over 36 locations in Berks County. So we're going to roll this out very slowly. They are still training and testing their call takers. We're still doing some software online testing, make sure everything works. Our goal is to have the Cook County Wellness Call Center available to people who do not have internet access, so they can call in and get help scheduling an appointment, as well as our software will be available for people to schedule online. So the call center will be open Monday through Friday, 9 to 5, with Spanish speaking help if needed, and we can expand those hours if necessary. That will couple with the North Reading Plaza Vaccine Center, which is imminent. We don't have an exact opening date yet. We do have staffing that is being trained to staff and vaccinate, to provide security, to provide registration at the site at North Reading Plaza. We can do probably with what vaccines are coming in today, about 400 vaccines a day, but we can max out to about 1,600 a day, about 8,000 a week, Monday through Friday, 9 to 5. If we need to flex those hours later on in the evening or weekends, we would do that. What I want to emphasize is this vaccine center is kind of for the long term. It's for the long haul. We still have a significant number of people in Berks County who have not been vaccinated even the first time. And it's going to be, we've leased it for at least the next 5 to 6 months, if not longer, if need be. BARDA will again be providing free fixed route service on Route 1 and 3. Route 1 is the one that goes directly out 5th Street Highway. Route 3 is the one that goes out Kutztown Road, back and forth from Center City, Reading, as well as our shared ride service. If you're unable to get on a fixed route bus, we will be accommodating you on a paratransit facility. So far, 167 trips have been taken by people to and from the various vaccine centers located throughout the county. So everyone's geared up, ready to go. We just got to make sure we get additional vaccine and get people staffed up and trained, and we're ready to go. We don't have an exact opening date. We don't want to put something out there and overpromise and underdeliver, but we definitely are going live with the call center Monday morning. It's a 188 phone number, which will be made available Monday morning, because if I gave it to you now, you would call in and get a voicemail message. So we don't want to get people more anxiety than there already is in the community. But honestly, it's going to take us probably through the summer to late summer to get everyone in the community who wants to get a vaccine vaccinated once, if not twice. So again, we have this set up for the long haul. And again, my heart out to the community health center and all our partners in putting this together. No one has said no. Everyone has stepped forward and said, what can we do to help? Again, with our community partners that are on this call today, thank you, thank you, thank you as a commissioner in Berks County for everything you do to help our people. Thank you. You're muted again.
You'd think I'd know better, but now you're muted. Okay. I think it is so important for us to all understand, and everyone that you've heard from so far is doing something they've never done before. There's no roadmap. Cola, Ed, and Michael, you didn't have a manual on a shelf that said, okay, you have a pandemic, you need vaccine, here's what you need to do. And neither did the county. And it's so important to realize the work that went into this. Our internal lead was Brian Gottschall. Brian has really shepherded this beginning to end. Commissioner Barnhart was the commissioner working on this. But this was new for Berks Community Health Center. We had to sit down, their legal, our legal, Paul Bradshaw, figuring out how do we put this agreement together? What can we do? BCHC is contracted, maybe is the wrong word, but they work as an arm of the federal government. They're connected directly to the federal level, and they're stepping up and being part of this is critical. Without them, we couldn't have done it. And Cook County Wellness, I think many folks know and understand. They got involved with the county out of the gate, and it's another group. I've never worked with Cook County Wellness prior to the COVID-19 pandemic. They took on the contact tracing. They've done an amazing job. And I just want to thank everyone for stepping up and dealing with something you've never dealt with before. And that's a great entry to our next panel. You would think that doctors, especially veterans like Dr. Powell and Dr. Keller, they've seen everything. I think they would tell you, I think they believe that a pandemic was very possible at some point in time, but you can't predict these types of issues. So let's go into the next panel. We're looking at vaccine, the COVID-19 vaccine, education, safety, efficacy, and we're really pleased to have Dr. Deborah Powell. She's the section chief for infectious diseases and the medical director for infection prevention at Tower Health Reading Hospital. Dr. Powell's been a frequent spokesperson for Tower on issues related to COVID-19 in the media and during town halls and other events. Dr. Mary Keller is the Chief Medical Officer for Berks Community Health Center. I was just with her and the other commissioners and Co-County Wellness doing a tour a couple days ago with over at the plaza of the new vaccine center. And then I mentioned Dr. Held would have been part of this, but Dr. Held, Dr. Keller, and Dr. Powell have been and continue to be part of the COVID-19 Berks County Health Advisory Panel. They've been doing that, I believe, since late April, early May. Been a great asset to us as county leaders, and I know they've been an asset to their community. So we'll start with you, Dr. Powell. If you could share your thoughts on what can you tell us about the vaccine? And obviously the one thing that is top of mind right now is the J&J vaccine, the pause. I know you look at the media, and I probably shouldn't watch the news anymore, but there are people that are apoplectic over overreaction of the FDA and the CDC pausing on the J&J based on 6 individuals dealing with blood clots. I looked at that, and I know, Dr. Powell, I read your comments. You said the same thing and said, this is the amazing aspect of the American health system, that we don't ignore things. Pausing and making sure everything's okay makes sense. So if both of you could address the J&J issue as well. So we'll start, Dr. Powell, your thoughts and input on this important topic.
Yeah, and thank you for having me again today. I always appreciate getting the message out to your listeners and to this panel too. So again, we're seeing an uptick in cases, and I think that we should have to reiterate that. We're seeing more inpatients than we've seen the last several weeks, and more children are actually being admitted. And our demographic of those admitted has shifted. Back in December, about 2/3 were over 65 and about 1/3 less than 65. Now it's about 50-50. And I think we've done a really great job in getting those over 75 and over 65 vaccinated. And now we have to make sure we vaccinate the rest of that group. And I was really privileged to work down at the Hispanic Center on Saturday giving those vaccines. And I'll tell you, that was uplifting. I took care of a lady in her 80s who got up at 4:30 in the morning because she was so excited to get her vaccine. And families just so overjoyed to be able to kind of rejoin their families again. So I think it does really give you a nice boost. So what we have available now are 2 really highly effective vaccines that are FDA approved under EUA. Those are the Moderna and Pfizer vaccines. They're mRNA vaccines, highly effective, 95% effective. We really hardly ever see a vaccine this effective. And the primary side effects are mild: sore arm, fatigue, headache. Some people get a fever, but usually within 24 hours, it's over. And then the shifting variants, it is effective against the predominant UK variant that's kind of emerging. So want to really reinforce that those vaccines, we've given like 121 million doses of vaccines so far, and really low side effect profile. And even the J&J vaccine, 6 women between 18 and 48 got this really rare side effect, or I should say complication. Is it related to the vaccine or not? Totally not clear, but we are seeing some increased clotting in people who get those viral vector vaccines. And it may be an immune response that kind of interferes with platelets, maybe kind of like what we call HIT, the heparin-induced thrombocytopenia that we possibly see. So we need to pause, kind of take restock, see what the rate of this complication is in the general population, and see if it's higher in this group or not. So I think the pause is appropriate until we get more information. So this was done under an abundance of caution. But again, we've given a lot of these vaccines out, and really low side effect profile, much lower than what we see with COVID. So it's all risk and benefits, and we have to kind of reinforce with the population that we still need to get the vaccines administered.
And if I can jump in, if you can explain, no one is destroying the vaccine. It's just simply being set aside so that they can make a good decision.
Right. And they're investigating. And again, you don't want to continue if there's something that we need to look at. But again, it's 6 people out of over 6 million doses given. 1 in a million. And honestly, I heard on the news last night, you have a higher chance of getting struck by lightning, which is about 1 in half a million. So, keep that in perspective.
Thank you very much. Dr. Keller.
Today was a day that I was seeing patients. So I was in the office and had discussions all day, as I do most days, about the vaccine and about overcoming vaccine hesitancy. And the number one thing that I hear are, I'm afraid of that vaccine. So there's a lot of fear. And I think our job is to try to understand, where is that fear coming from? There's a perception that this vaccine was rushed. There's a perception that the vaccine wasn't studied. There's a perception that the vaccine maybe was studied, but not in people that look like me.
Yeah, just for clarification, you're talking about the vaccine generally, not just J&J right now.
Yeah, I think most people who are saying no to vaccine often are saying no to all of them. There's true vaccine hesitancy that they haven't even gotten to the point of thinking through which vaccine would I choose. Sometimes you can have that conversation to overcome that vaccine hesitancy and explain one vaccine or the other, but there really is a group of people who are just truly afraid of getting vaccinated. My response to them is that it's okay to be afraid, but they should also be afraid of COVID. And, sometimes I think that we've heard so much about COVID, we've seen so much about, and on the news, that people forget that it really is real. It really is a devastating disease and has caused a lot of people to die and have some permanent disability related to it. So yes, you can be afraid, but you also should be afraid of COVID. And I think sometimes you get people to think of it that way, and then they start to realize, that we want to do what we can do to keep ourselves safe. And right now, the vaccine is a very important part of that, of keeping ourselves safe. I've shared with my patients, I'm one of the healthcare providers who had COVID and got pretty sick. My oxygen level drops. I had coughing. I had some shortness of breath. And for the first time in my life, I was laying in bed wondering if I was going to have it tomorrow, wondering if I was going to see grandkids, if my kids were going to grow up, if I was going to end up in the hospital on Dr. Powell's team, if I was going to do that. And I was afraid, and I'm not usually afraid. People in doctor's family know that, kid comes with 103 fever and we say, take Tylenol, not too much frightens us, but I was afraid. And so what I want people to know is that that's real. And the vaccine is an opportunity to protect ourselves, to protect our families, and to protect our communities. So sometimes the decision to vaccinate is not just a personal decision. It's really a commitment to the community of trying to end this pandemic or slow down the pandemic. Because if we don't, there are going to be more neighbors, more relatives, more cousins, more family members who end up in the hospital, and some who are not going to be as lucky as I was to be here talking about it months later.
Thank you very much. At this time, we're going to go to some questions. And if a resident has questions about the safety and overall vaccine efficacy, and this might sound obvious, who should they contact? And the reason I ask that is right now, people go to a lot of different places to find the information. And I'm going to open this to anyone, our doctors, our pharmacists, even Michael Toledo. Who should people contact if they have questions on the efficacy or safety of a vaccine?
I'll take that one first. Your trusted healthcare professional, whoever that may be. So maybe your PCP, it may be your local pharmacist, but I wouldn't go to Facebook and I wouldn't go to the internet. I would go to someone who knows medicine and ask them those questions.
Absolutely. Anyone else? Pharmacists often are missed as a really great resource, not just on drugs, but something like a vaccine. Ed, Cola, do you want to jump in and share your thoughts?
Absolutely. I mean, we see our patients almost weekly, monthly. We know their fears, we know their questions, and we are trying to dispel a lot of missing information on Facebook and on the internet, and trying to educate them on how to look at data that's accurate. It's some data they are misconstruing and putting it together in ways. Somebody puts on a lab coat in a YouTube video and is giving information about, how the vaccine is prepared and stem cell research, and it is just unfounded. And it takes some time to get a person to understand that all information isn't accurate, so that they feel comfortable believing in me, believing in their PCP. We're the ones entrusted to their care, and they come to us for a reason. And I think partly because we listen to their fears so that we can dispel misinformation. And I think that's a lot of the fear out there, is just misinformation. All of his medication, and refusing the vaccine because he was told that he was going to be chipped and the healthcare system would not his medication. And we had to get social services involved because it involved his wife. So it's navigating and listening to the words that they're speaking so that you can give them the information that they need to make a better decision for themselves. I don't know if you agree, Cola.
Well, Cola and Michael, I don't want to make an assumption here, but there are people, groups, and I think you alluded, you were having difficulty, Cola, getting African American community to respond, and you reached out to the NAACP. What role does an organization like that play in the trust issue of getting good information to a community?
I think they could play a very significant role in the African American community. A lot of the elderly over 65 and over 65 years of age still remember the history of the experiments, and so that played a lot into why they were very hesitant. So the NAACP partnered with some of the healthcare professionals that are members of that organization to help alleviate the fears of such people. And it's an ongoing effort. I think they continue to do that, and hopefully that would help with the hesitancy problem.
Absolutely.
Yeah, I would agree with what Cola shared. I mean, again, as organizations, we play such an important role because we are the lifelines to certain segments of our population. So from the Hispanic Center's perspective, we're talking about not just again the Latinos in the community, but you also have mixed status families, you have undocumented family members, individuals, and there's a lot of fear that I'm not going to come and register somewhere. So now that my information is now gathered and I'm going to get, somebody's going to come pick me up. We have to dispel all those myths and all the nonsense that's out there on social media. So the role that we all play as trusted partners in the community, from pharmacies to the healthcare providers to the nonprofit organizations, again, if the pandemic has shown us anything, it's that our roles in our community are so valued, and there's a lot of responsibility that comes with that. And we all have to do our part to dispel those rumors, because we have to be there for the communities that trust in us.
I'm going to, before I go to our pharmacy owners and ask them to comment on the value of local ownership, I want to go to Dr. Keller and Dr. Powell. and I'm just going to put you on the spot. Is this issue, the issue of chain pharmacies versus local ownership? And I understand the medicine shop is, I guess, like a franchise, but the bottom line is they're locally owned. Is this an issue you ever looked at before relative to the delivery of healthcare?
I would say anecdotally, yes. We're located down on 838 Penn Street, so we have Penn Pharmacy like on the corner, and our patients, Phil at the pharmacy, and we call and he answers, and we know, and they're walking across the street. And we've also had West Reading Pharmacy. A lot of our patients do, and there does seem a difference when you call the locally owned pharmacies, that they are part of the community. The patients know them. They've been part of the community often for a very long time. So a lot of times there is established relationships with them. I think this is an example of how you can always enhance the collaboration of healthcare providers and pharmacists, because we're doing it quite successfully in tackling the need for COVID vaccines. But there has always been a different feel when you're calling a pharmacist who has their roots in the community and the patients know them, as opposed to some of the bigger chains where you may have rotating pharmacists each week and there's not that established contact and face that the patients become familiar with.
Sure. Dr. Powell, your thoughts?
I agree with you. I think that it's building relationships, again, patients' relationships with their providers and with their pharmacists. So again, established pharmacies that are local, who know your patients, they come in every month to pick up their vaccines, really does strengthen the medical bond that we all have.
Yeah, and I want to make it clear, I'm not being critical of the chain. I know some of the pharmacists in those chains would love to be able to do what Ed and Cola have already done, but that's not how these chains are structured. They just can't say, you know what, we're going to make a decision, we're going to go out into the community. But Ed and Cola, you are, and what has this helped spotlight relative to local ownership of pharmacies? Whoever wants to jump in.
I think it's that we find solutions to problems, and I think it's because we're able to listen and direct ourselves without having a corporate structure above us that pigeonhole us in our decisions. So we're able to look at each patient, what their need is, and evolve our practice to incorporate those needs. So when we shut down the state back in March, I got to work, I think, at 3:30 in the morning, and filled prescriptions for about 3 weeks out for all my patients, because I knew one of the fears was going to be the plans go down, and my wife at home was going through looking at our spreadsheets of what our inventory was, what we needed to order, and made sure that she was able in inventory to accommodate for about 3 months, just to make sure our patients had what they needed. Morning, when we opened our doors at 9 o'clock, we called every one of our questions into their hands, and they, the next day, over the next 4 months, were offering volunteering to deliver for people because they weren't able to come into the pharmacy as they normally would. They were bringing us lunch and dinner. They were just trying to help us through the process, because they knew that we took a little different approach, because we knew that people were going to be fearful of where their medication was going to be coming from, if it would be available to them. We also had our doors open when doctors' offices were closed. So we're triaging patients, and I was calling them and texting them because they were fearful of going to the emergency room. They're fearful of going to urgent cares, that their offices were closed. So we kept that connection to their doctors and triaging whatever we could within our practices. I'm pretty sure you have the same thing going on with you, Cola. I mean, it was, and it just revalidated everything that I've done in my practice since I've graduated, to make sure that patients had accessibility of healthcare, that they had somebody advocating for them. it was great. And that just brings up right now, I mean, I think Cole and I would love to see that we would be able, that we would get provider status with CI now. And, you know, that some litigation or some legislature would change for us, because right now I'm top 10% of my peers 5-star rated. These are killing us with these Medicare Part D plans. And it's, you know, Cola, are you going to agree with me here?
Yes, well, let me first say that my wife is the pharmacist, and I'm the co-owner, but I'm more on the business side. So she could probably speak more to that. However, I've seen this much. The appreciation shown by several of the customers. The relationships are just so rewarding on both sides, that and very, very personal, if you will. We do things that some of the other chains cannot do, such as free deliveries at different times, odd times. Sometimes our patients would call, and some of them could even call the cell phone at very different times, maybe on the weekends or something, and we'll jump up and go and serve them in that way. And as was mentioned earlier, some of them would come to your pharmacy and bring you food and flowers and things like that, things that they couldn't do that in the big pharmacies. It's just not allowed. So that makes it very, very rewarding. Now, as you mentioned there, you know, there is competition with the big you know, pharmacies. So whatever legislation that they can come up with to help the small pharmacies, that will be good.
One of the things I'd like each of you to share thoughts, if you're comfortable, through this pandemic, the government level. I can speak as somebody who is in the government. Early on, we were listening to the press conferences in Washington. We were listening to the press conferences in Harrisburg. And for myself, I got to a point probably late May, early June, where I stopped listening to the press conferences. I found it confusing. They would tell you one thing a month before and then change it. And the frustration was the sense that the government really didn't know exactly what they were doing. And when we came in to testing and then vaccine, we really struggled. And what I've come to appreciate is that the best solutions and the best ideas come from local, non-governmental people. That's one of the reasons we set up the health advisory panel. We felt we needed to deal with people we knew locally, and Dr. Keller, Dr. Powell, and as I mentioned, Dr. Held's been part of that, and a number of others. But I think that's also true with the stories we heard from the Hispanic Center, the Medicine Shop, and Oakbrook Pharmacy. You had an idea of how you could address the situation. I would suggest that if you had waited for the government to come to you and say, here's the answer, you may still be waiting. But in each of your cases, you said, we see a need in our community. We're going to do what we can do. That to me is what makes a difference. Tower Health has done that. The Berks Community Health Center has done it. Penn State St. Joe's has been doing that. The county has tried to do that as well, even though I know we're part of the government. Talk a little bit about why that's important, why entities like you and your organizations shouldn't just simply sit back and wait for higher authority to say, here's what you need to do. That might sound obvious, but I will tell you it is not that obvious to the general public, and I don't think a lot of them realize how much each of you have done and are doing that's within your power to influence the change and influence the impact on the pandemic? Who wants to jump in and tackle that?
Commissioner Leinbach, I can speak to from a nonprofit perspective. You know, the nonprofit organizations, we have our finger on the pulse of our community. Mm-hmm. We understand the challenges. You know, we are a bridge to them. And I think that's number one. That was the first thing that allowed us to understand the importance of the role that we had to play. I would say number two is our ability to be able to, the motto here at the Hispanic Center, ask our staff, is adjust, adapt, and overcome. That's what we're able to do as a nonprofit. We're able to adjust to the needs and adapt to the circumstances that we are dealt with in order to meet our mission and the work that we want to do in our community. Lastly, I can just speak to, again, the fact that I have a board that supports us 100% in the work that we feel we need to do. When I go to my board and say, you know what, we're going to try to be the largest vaccine clinic provider for nonprofits in the city, because that's the need. Can you support that effort? There was not even a question. They said, Mike, if you feel you can partner with the community partners and you have the ability to reach folks where they are, we stand behind you. So I think understanding our community, again, being able to adjust on the fly to the needs of the community, and again, having local governance that says, you know what, we stand with you, we're gonna go with you, has helped the Hispanic Center in my ability to partner with the hospital, with Oakside Care Pharmacy, with the county, with aging, to be able to meet the needs of the community where they are.
Thank you, Michael. Somebody else want to jump in and touch on that? Dr. Keller.
I think I would respectfully disagree a little with the premise of your statement, because I do think that part of the reason the pandemic has played itself out as the way it has is because we started at a not so consistent federal response to it. So we all kind of have known in the news that there used to be a pandemic office that was disbanded, and a lot of resources that were set outside to prepare for it were kind of not ready. So I think there was a lack of a consistent federal response at the beginning of the pandemic that trickled down to some of the chaos that we saw on the state level. So I really, and maybe, you know, my background is also in public health, that I really think a coherent public health response to a national pandemic is necessary. Mm-hmm. And part of what led to the chaos is that some of that was not there. And I think, you know, vaccine rollout and getting millions of vaccines out to states needs a federal response. Funding for things like vaccine production needs a federal response. The state did the best they could at times, as we all did the best we could with the information we had. So I think what we learned from this is not that it should always be left at the individual local level, but a stronger state and federal response, and an organized state and federal response would then allow the local level to respond better to the pandemic. So I think that's what I would add to that part of that discussion.
Absolutely. Any other comments?
The only thing that is a little frustrating, I think, is we did go from 1,700 providers to 300 in Pennsylvania, and I think we're all doing a great job. But what limiting the provider pool is just limiting those people that would feel more comfortable going to maybe a pharmacy setting or other locations. I mean, now that we've gotten a steady stream, I mean, I'm proud to say that I'm administering this many vaccines to the community, and I know that we all are. But I almost wish that, you know, now that the federal program has opened up and pharmacies are getting some doses, I'm kind of happy that they're filling in the gaps where we may not be able to hit. You know, whether it be a chain pharmacy, you know, or a local pharmacy, or even some of the doctor's offices. I think that their plan actually helped but now it's time to reopen some of the providers a little bit, you know, just so that I think they were just trying to fix dose insecurities with what happened in February with the second dose allocations. And I think this was a means of doing that partly, but you may disagree. But I think we need to open up some of the other providers to see if they can possibly start helping filling in the gaps where we aren't maybe hitting. Leave no stone unturned.
Sure. Any other comments? Let me go to John James from Burnville, Pennsylvania. He says, thank you, Mr. Sulaco, for mentioning the hesitancy of older African American and making the distinction with the anti-vax movement. Can people choose which vaccine they are administered? We'll go to Mr. Sulaco first, but if any of our two doctors want to address that afterwards, feel free.
We currently have certain vaccine types. It could be Pfizer or Moderna. So based on that, the clinics we offer do not provide any choices. So you either accept what we have to offer, or maybe you'll come back when we have a different vaccine, or maybe try a different provider that may have the particular one that you want.
Thank you. Any of our doctors?
Yeah, I agree. I think that you have to kind of, if you have a preference, you have to find a pharmacy or a vaccine center that carries that product. And honestly, we get what we get from the state every week. So it may change from week to week.
Correct.
And we can't always promise you're going to get a certain type of vaccine. And some of these pop-up clinics we do, it depends on what we receive.
Yeah.
But honestly, I consider them equivalent. Moderna or Pfizer, I say just get a vaccine as quickly as you can.
Right. And from a safety perspective, one of the things that we said is what we don't want to be mixing vaccine products on the same day in the same clinic, so that when someone is being seen, there's a consistency with what's being given, so that you're not having someone who had a Moderna dose get a Pfizer dose. So from a safety perspective, that's the decision that we made. We did have access to the Johnson & Johnson, so we had Moderna and Johnson & Johnson. And if someone was interested in Pfizer, then we referred to the community partners that might have Pfizer available. So people do have the choice. To Dr. Powell's point, I try to get them to explain to me what are they thinking, because that sometimes can target their fears about vaccines in general, because their rationalization to pick one or the other might not be, you know, valid, and then you can convince them to just get the vaccine that's in front of them if you break down some of those, you know, rationalizations of why they think one is superior to the other.
Thank you very much. I want to open it up to my colleagues. Do you have any comments, questions for the panelists, Commissioner Barnhart, Commissioner Rivera?
Other than I just recently turned 62 and I still continue to learn things every day. Just listening to this great group of people, I just learned so many things this afternoon. Thank you to Stephanie Weaver for putting this together and everyone's participation in this effort. Thank you.
Thank you.
Yeah, I have a question. I guess it would be addressed to the doctors. The vaccination for those who already got COVID is, I mean, if you got COVID, do you need the vaccination? Should you get the vaccination? What's the latest on that?
Yeah, we're recommending the vaccine to everyone, those who had COVID and those who didn't have COVID. If you had COVID, you may have some antibodies, and depending on how long ago you got COVID, they will last for a certain period of time, and the vaccine will boost that response to give you more antibodies that will protect you. So we're recommending everybody get it.
Okay. And another question, and I didn't see this, someone just showed me parts of it, but there's a video out there that it's supposedly someone who's a biologist. I'm not sure what his background is, but he's saying that with the vaccine, you actually, it alters your DNA and you can see some effects 10 years down the line. What's the truth behind that, or what can you say about that?
Yeah, that is not true. So the mRNA vaccines give you a little piece of mRNA that's fairly fragile, actually. So the vaccine is actually coated in lipid, and within a very short period of time, your body destroys it. So basically, you're making a protein that your body makes an antibody against. So that's not the concern.
Okay. That's all I have, but I do want to thank all of you for your time, and not only your time today, but your time for the last year and everything. I know the doctors here have been part of our health advisory panel for a while. You've been doing a lot around COVID. Thank you very much. Thank you to the pharmacy owners, to Ed and Paula for all you're doing. Continue to do the work in the communities that you're at. And Mike, thank you for the work that the Hispanic Center is doing for a greater Reading community, not just the Latino community, but the community overall as well. So thank you very much to everyone who's doing your part so that we can get through this and move on to some type of normalcy within our lives. And the sooner we can do that, the better. So thank you very much.
Thank you.
Yes, thank you very much to our panel. I continue to be amazed at the people that make up our community. I hope that for people either that have watched it or will be watching this program in the future, that you too will be excited to know that we have people like Ed and Cola and Dr. Powell, Dr. Keller, and Michael in our community that care deeply about what is happening, and they care enough to do something about it. A lot of times you hear people complain about what's happening, but it's the rare few that say, I'm going to do something about it. And these folks have stepped up. They're part of it. They're part of the solution. We really appreciate it. Again, if you want more information on the latest COVID-19 data, tune into the commissioners meeting tomorrow at 10 a.m. If you're not available at 10 a.m., go to the Berks County Facebook page or YouTube page, and you can watch that at your convenience. Stephanie Weaver, I know you're on. Are you prepared to let us know what is scheduled for next Wednesday afternoon's Commissioner's Weekly Update?
Sure. We actually have a slide that the IS team can pop up if they want to. Next Wednesday, we're going to be doing a program focused on, celebrating National County Government Month. The theme this year for that is Counties Matter. So we're going to be taking a look at kind of the different holes that county departments have really filled throughout the past year with the COVID pandemic, and kind of highlight some of that so that the community can see kind of the different services that maybe aren't always in the news or the spotlight, to kind of just show what the county does and how we serve our community. And then the following week on the 28th, we're going to be doing a primary election preview or update, just to kind of get the community ready for the election on May 18th. So we do have a slide prepared, I believe, to help promote that.
If we do, we'll end with that. Stephanie, thank you for your work in helping to put these together, and for the IS team. Without them, there would be no Microsoft Teams Live event. So thank you very much. Thank you for joining us on another edition of the Berks County Commissioners Weekly Update.
Thanks, everyone. I've